What made my change was that there was a lot of literature around using this equipment, and I felt that it looked like it would be safer and more beneficial for the patients. And lots of this was discussed at conferences that I'd been to around the world.
So we were trying to do surgeries a little bit further on the angle of the jaw and the body of the jaw. We work a lot of recontouring of the jaw and chin. And at some point we were not able to perform the surgical maneuvers that we needed. So when we started to work with Piezosurgery, it gave us the possibility of making the cuts that we need in a very safe way, and it was something we were not getting with the standard saws. So we changed for Piezosurgery.
So pediatric neurosurgery is dealing sometimes with very delicate bone and delicate bone cutting, for example in cranial deformities, but also in spinal surgery. And we were looking for instruments that were very well steerable and had probably also very thin bone cuts.
Piezosurgery allows for a more accurate osteotomy, and in fact I also use it in larger osteotomies, not just in small bone osteotomy. Plus it's also extremely safe compared with other types of instruments, because it does not cut through the soft tissues, and it allows for a very accurate osteotomy without damaging the surrounding periosteum. Periosteum is the key when you do, for instance, pediatric orthopedic surgery, because you want to preserve it to allow for bone union. So performing an osteotomy without damaging it would create a better environment for bone healing.
The main advantages for intraoperatively is there is a more tactile feel when using the piezo. So I think I can have more effective, more complex cuts that go closer and less damage to the vital structures such as the nerves and arteries. This gives me a much better outcome, much more predictable cuts than the normal effective rotary or saws that we used to use.
The main advantages are the precision in terms of osteotomy line and safe in terms of protection of important anatomical structures.
The main advantages in using Piezosurgery for the patients is first that we are able to do a much more predictable procedure, which will deliver a better result at the end of the recovery. And one of the main advantages is the post-op, of course. So the post-op of our patients changes completely. They have much less swelling. The chance and occurrence of post-op bleeding was extremely small after using Piezosurgery. So there are many advantages that are from the immediate post-op to a long-term post-op.
So you are having a very nice control over your bone cutting and bone modeling. This is first for the quality of your bone cutting an advantage, and also I think in certain aspects it is an advantage in respects of safety, especially when you are thinking of cutting the dura, which you would like to avoid in, of course, most of the surgeries.
Piezosurgery can be used more safely, more precisely, and with less damage to the soft tissues, and with more accurate cutting, and probably it's possible to do in a semi-blind surgery with less exposure.
I definitely completely changed it, because now with Piezosurgery I can also make smaller incisions, I can work in smaller, narrower places, and being it so accurate, I can work also in pediatric bone with a lot of safety and a very small incision. So it allows me to perform a slightly less invasive surgery.
Yes, we did. We changed how to do the spine surgery. We can perform a multi-level laminotomy without losing bone tissue, and we can perform at most 5 separate lamina.
Following on from the last question, I would like to add that I found it extremely useful for training. So I train a lot with the Piezosurgery, and I have lots of positive feedback from trainees saying that they love to train using the Piezosurgery, as they feel it's more comfortable and safer to use.
There are surgeries that I wouldn't do anymore without piezo, and mainly I would say procedures done on the skull that are close to the dura mater. And in the lower jaw, any recontouring we will do it to piezo, because we see how different is the effect on the post-op, and how different is the predictability of the cuts when we are using Piezosurgery.
My suggestion is that for segmentation or fibula flip-flap is an useful instrument, and today maybe I can't do it without Piezosurgery.
Yes, I think Piezosurgery is an asset to what we do. I really think it's a significant technological advancement in the surgical field. It's safe for the patient, so I would continue to use it, and I recommend to try it.